Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Tibia. The tibia or shin bone is a long bone of the leg found medial to the fibula. It is the second largest bone in the body after the femur. Like other long bones, there are three parts of the tibia: proximal, shaft and distal. Proximal part landmarks: lateral and medial condyles, articulation with femur knee joint, tibial plateau, anterior and posterior intercondylar areas, tubercle of iliotibial tract, tibial tuberosity. Shaft landmarks: posterior, medial and lateral surfaces, Soleal line, posterior surface, anterior, interosseous and medial borders. Distal part landmarks: medial malleolus, articulation with talus angle joint, fibular notch, articulation with distal end of fibula. Joints: knee joint, ankle joint, superior or proximal tibiofibular joint, middle tibiofibular joint, inferior or distal tibiofibular joint. Muscles attachment: muscles that insert onto the tibia: sartorius, gracilis, quadriceps femoris, semimembranosus, semitendinosus, popliteus. Muscles that originate from the tibia: tibialis anterior, extensor digitorum longus, soleus, tibialis posterior, flexor digitorum longus. Clinical notes: fractures. The tibia is the most fractured long bone in humans. Its most vulnerable part is the tibial shaft, and it generally takes a strong force to break this bone. Transverse fracture: the fracture line is horizontal through the shaft. Oblique fracture: the fracture line is angled through the shaft. Spiral fracture: the fracture line is spiral resulting from twisting of the bone. Comminuted fracture: the bone is broken into 3 or more pieces. Open fracture: the broken parts of bone penetrate the surrounding skin and communicate with the environment. High risk of infections. Thank you all. Have a nice day.